And my presentation on sepsis biomarkers is about a new area of research in which I try to convey the message that biomarker-guided specific therapies are the way to go in the future. Thus far, sepsis trials have been based on enrollment of patients with a certain severity of disease rather than with a certain pathophysiological profile. So in immunotherapy trials in sepsis, these were given to patients with more severe disease, and they did not examine the target of the immune therapy. So in the future, I think that we need to specify the expression pattern of the target that is targeted by the immune therapy, and only select those patients that are likely to benefit from a certain immunotherapy, rather than selecting patients with more severe disease. The biggest point in this topic is that thus far there has been no attempt whatsoever to look at the immunological profile of patients with sepsis. Although the therapies that have been tried over the past 30 years that seek to modify the immune response in patients with sepsis target specific components of the host response to the infection. So we need to put more effort in discovering biomarkers that reflect the activity of certain immunological pathways that we seek to target with our immune interventions. And in doing so, we are more likely to provide benefit to patients with sepsis. More benefit than thus far, because thus far all clinical trials seeking to modify the immune response in patients with sepsis have been negative. This is an important research for me personally to study. Well, it starts obviously that it's an interesting topic, and it's also an unresolved issue in the treatment of patients with sepsis. So sepsis prognosis is still pretty grim in terms of that approximately 25% of patients die, and we need to improve that. And looking at the immune response in patients and seeking to modify that seems to be promising, although thus far extremely unsuccessful. No positive clinical trials, and I'm looking forward to see this changed by this new approach.